It's Monday, October the 3rd. This is the Dr. Simon's Metabolics Ask Me Anything Facebook Live. We're answering your questions about weight loss, as we always do. We've had a kind of a little bit of a hiatus here over 6 weeks. Had no one of these in 6 weeks, and we're now over 50 episodes, Michelle tells me.
Yes, I was just looking, I couldn't believe it.
You can go back and watch those. They're all chronicled.
Mm-hmm. Yeah. Yep, on YouTube,
That's
on
right.
our website as well, and our Facebook page.
That's right. So we're giving away a $25 gift card, as we have been doing.
Yes.
And to do that, Michelle, you, the listener, have to do two things.
Yes, please. Everyone who is watching live this morning, we want you to like this video and comment #SimonsAMA. Do those two things. You'll be entered into the gift card, and we will draw the winner at the end of the show. If you're watching it recorded, make sure to try to tune in 2 weeks when we're back at 10 a.m. on a Monday. And you can also comment and ask us questions live. A lot of people have been great about doing that, yes. Commenting and questioning. So we have questions that people send in that we print out and we address, but we also are happy to talk to you. If you are here, we always have Susie. Yeah. Susie's on it. Thank you so much, Susie, for being such a loyal watcher and patient for us. So anybody else, enter. Otherwise, gift card Susie's.
That's right. Susie, you have 100% chance of winning right now. I can't think of a nicer person to get the $25 gift card. All right, so we're going to start today with Jane from Morrisville. And her question is, how do I know what a healthy weight loss goal is for me, and how many calories should I be eating? So, kind of two questions there.
Yeah, I think the first one, we do get that a lot. What should I weigh? Is my goal reasonable? And honestly, from an obesity medicine specialist standpoint, 5 to 10% body weight loss is considered significant. So if you're 200 pounds, that would be 10 to 20 pounds of weight loss. Okay. Yeah. That is not typically as much as folks want, or they believe they need to go off of what we consider the BMI scale, which is a population-wide measurement based on your height and your weight. And there's different categories. So a BMI between 18.5 and 24.9 is considered a healthy weight. 25 to 29.9 is considered to have overweight or pre-obesity. And then 30 and above is considered to have obesity. That is not always what drives us to help people set goals or achieve goals. Although on the internet, you will find that is the most common thing, is get your BMI either under 30 or under 25. For a lot of patients looking to lose weight, that is not a realistic or necessary goal. 5 to 10% is fantastic, Jane. So wherever you're at now, if you're able to lose just 5% of your body weight, so many significant health improvements will be achieved from that. If you want to lose some more than that, that's okay, but it's not absolutely necessary, right? At that point, we're looking at comfort and maintainability, because sometimes the weight that we want to get to is not as achievable as a weight that we can maintain long term, because of the level of restriction that we're going to have to live with in order to stay that lower weight that we had our mind set on. Mm-hmm.
That's right. And for those of you joining, thank you for joining. We have a $25 gift card in play today from Target, and you have to like the video and comment #SimonsAMA. And so this is the Ask Me Anything Facebook Live that we do. Yes. Dr. Simon's Metabolics and Weight Loss Ask Me Anything Facebook Live. It's Monday, October the 3rd, for those of you who are just now joining. And anyway, so we're talking about Jane's question from Morrisville. She had two questions. How do I know what a healthy weight loss goal is the first question. Michelle made some very good points. I'm not a big fan of the BMI. I think the BMI was intended initially to be a population assessment tool to be applied to populations rather than to individuals. And at the time this happened, there really wasn't an agreed upon definition of what obesity and overweight was and so forth. So organizations just picked up that ball, despite the caution not to apply it to individuals, and started applying it to individuals. Now, the way I explain it to patients is, you never look at another species of animal and use this sort of reasoning. This sort of reasoning and it is like, Star Wars. Stormtroopers are all the same size. They're robots, right? But people and dogs, for example, don't. They come in different sizes, right? So you would never look at the Saint Bernard and say, "Hey, you're way bigger than the Labradoodle, so you got to lose some weight." Right? You see what I'm saying? It's
meant to be.
We say, okay, now the Saint Bernard is supposed to be a big dog. Now we don't want them to be overweight for that kind of breed, right? So people come in different shapes and sizes, and I think that. You make a really good point about talking about what medically significant weight loss is. So Michelle made the comment about 5 and 10% of your weight. Now you can always do more than that. Okay, you'll know what's right for you. In most cases, you'll know. I always say that the moment comes when you're standing in your underwear in front of the mirror one morning. You're like, oh, I've arrived, and really it's hard because of body types to know exactly what that weight's going to be for a lot of people. But the really medically significant stuff is 5. We've had a couple of organizations batting around the idea of 5 or 10% of body weight loss and what that does in terms of cutting your risk of developing diabetes or high blood pressure, that sort of thing. And it's significant. It's over 50%. So Michelle makes a point, you don't have to lose a lot of weight to be healthy, right? Okay.
Absolutely.
And there's a second part of that, which I think is never said, which I like to say, which is if you gain 5 or 10%. This is what brings it on. And when you look at it like that, you're like, okay, this is, heretofore in the medical community, what's happened is we wait till people get really overweight and they're beset by these problems. And then we say, hey, let's intervene. That's letting the horse out of the barn and then trying to send a bunch of people out to round him up, right? Why don't you never let the horse get out of the barn in the first place? History is going to judge us harshly on this, okay? We should be intercepting people when they are 1 pound overweight. Okay, when they start to gain weight, when they come in and say that, that's when we should be intervening. And that's how we get out of the current population problem that we have in terms of things like diabetes and these sorts of diseases. They start somewhere, and we ought to be intercepting that stuff really early on. And we currently don't do that. Michelle and I will do that. But as a medical community, we've not embraced that stuff yet.
That's absolutely true. That's absolutely true. And Candace has a wonderful point. A lot of patients do feel this way, that BMI is like medical shaming. And unfortunately, it has turned into that. It really has. There is a stigma. It is on your chart. Your insurance company knows when your BMI is over 30. And it really is a mark that will work against you in a lot of ways when it gets documented. So the fact that we still use that scale, we don't look at individuals, and we're using this population-wide thing, is something that will need to change. But as of right now, in our practice, we shoot for the 5 to 10%. We also use body composition scales, so we can look at not just your weight, which is more like your relationship to gravity, but rather your body composition, your body fat percentage, where you carry that body fat, right? Because we know a lot of linebackers have a BMI of over 30. That's right. They're huge, but they're solid muscle. So in their medical chart, they have a documentation of having obesity, but they do not have any of the health risks associated with it. Same with small individuals who are, Dr. Lawrence, or the Lawrence, I was like, my hearse is running wild. Come back in. We're going to help you. We're going to help you. But,
that's right. Time to get back in the barn.
Exactly. But we really want to go off of the body fat, because we even have thin, lean-looking individuals that have a high body fat percentage, and they have a very high risk for heart disease, diabetes, right? Other metabolic disorders. So we really want to treat the individual, and that is what we do really well here at Dr. Simon's office. Is we treat each individual as they need to be treated. We will set a goal with you. So if you really don't know or you're not sure, let us help. That's what we're here for. Good morning to you, Melissa. Thank you for everyone. Susie, Ben, Annette, De Laverne, Candace, and Melissa. Thank you so much, everyone who has entered. We have a good audience today. This is exciting.
So the second part of her question, which I see in some other questions here, has to do with calories. How many calories should I be eating? And look, I think you need to understand that starvation does in fact work. Okay, no one dies obese during a famine. They don't die obese, right? So calorie restriction will cause you to lose weight, and eventually you die. Okay, when you have starvation. So just think of calorie restriction as a controlled form of that.
Yeah.
Okay. Now, but what you eat matters. Okay. So calories aren't equal. All right. Radical calorie restriction will produce weight loss, but some calorie restriction and then saying, well, the calorie from the Twinkies is the same as the calories from the piece of meat or the vegetables.
We know that.
Yes, correct. That's exactly right. So to me, it's about calories and content, right? And when you're eating the right content, you can have more calories. Because there's another question down here. It's actually the last question. Peter from Raleigh, he talks about tracking his calories and still being hungry. And so what I would say, the way out of that, in addition to coming to see us and getting some medicine that will help control your hunger, right? We can help you with that, Peter. But the other way to deal with that is to eat the right content. And when you do that, you can have more calories and still lose weight just fine. I always say animals, what comes from animals and what you grow in gardens, there's your way out of it. And if you're eating that way, you generally don't have to track any calories.
Candace is saying that she feels the same way about the horse being at the barn. It can be embarrassing. And we are here to help.
That's right.
You are not alone. A lot of folks feel exactly.
The good news is I don't have to run out and chase you down like a horse, right? You can just come back.
Just walk in our office.
The door's open.
Help.
Yeah. And to me, I've always had to manage my weight. I just tried to set up a practice where you're never going to get judged for anything. Yeah. I mean, because once you're beyond the idea that you're perfect, then it's okay. You can just come in and we can help you, right?
Yes. No such thing as perfect. We all got our flaws. Some of us carry it on the outside, and unfortunately that leaves society with an open invitation to judge, and that's not okay, and we need to change that. But a lot of us have our own demons. We just don't wear it on the outside. But here it doesn't matter. It doesn't matter what you're wearing inside, outside. We are going to meet you where you're at. We are going to make you feel safe, trusted, and listened to. And that's really, really important. If you haven't got that other places, you will never, ever, ever expect to get that from us. I assure you of that. Okay. So the how many calories should I be eating? I will just touch on that. Jane's second question. That is also something that we can help you with, right? Part of what we do here with the body composition scan is we can actually see roughly estimate what your basal metabolic rate is. And I will tell you, even though we have those machines and there are fancy calculations, most of the time, right, you will find this on the internet, women are eating to lose weight between 1,000 and 1,200, maybe 1,000 and 1,400 with an average of about 1,200 calories. But the quality of those calories really matters, just like Dr. Simon said. And men is usually more between maybe 15 and 2,000, right? Depending, right? A lot of them are eating 1,500 to 1,600 to lose weight. That's not a general blanket, but that's just an idea, Jane, and for you, Peter, as well, who asked some really good questions about helping with cravings and still being hunger with calories. Protein calories are what to prioritize. Okay, we're going to move on to Shane from Cary asking, what is the best way to track my weight loss? There's a lot of things out there now that can help you track all kinds of things, steps and weight and calories and content of calories.
All feedback is good.
Oh yeah.
Yeah, because it creates mindfulness, and that's the key.
Yes.
So whether it's a scale or whether it's a measurement around your waist or whether it's the size of your britches or whether it's the number of steps you take or all that stuff, or the more of that stuff you put in there, the more mindful you are about what goes in your mouth. And that's what we're trying to create. Because once that happens, then you got it. Yeah.
Absolutely. And it depends on the person. Now, we've had patients that don't feel comfortable stepping on a scale on a regular basis, but they have a certain dress or a certain pair of pants or a certain skirt that they will try on every couple of weeks. And that could be their indicator. Other people will actually do measurements. So, Jane, there's really no wrong way to do it. It's really finding the best way for you, or the best ways if you are tracking multiple things, right? The important thing is that you are doing something so that you can track your progress. And that's something we can help with as well. Trey from Raleigh, is there a danger in losing weight too fast?
No.
Saw that coming.
I hear this a lot. And look, I understand the reason why people are concerned about it. Okay, so I think every person is different, but when you take groups of people and these studies have actually been done. The people who lost weight quickest initially were the people who kept it off the best.
That's surprising for
Okay.
a lot of
Yeah,
people.
right.
To
So
hear that.
it's also true that I have patients all the time who intend to make a change. They make a change, they lose weight slowly but consistently, and they do a great job of keeping it off.
Yeah.
So it depends on the person.
Mhm.
So what I don't agree with is the concept of, hey, it's a danger to lose weight too fast. That is true if you are too thin and you're
Yes.
trying to lose weight. You shouldn't be trying to lose weight in that case, but it is not true if you are overweight because you have excess body fat. Yeah, we now have plenty of studies that document the benefits of skipping meals, intermittent fasting, this sort of concept. It really is good for your health. Your body needs a break from this stuff, right? And all the food that we eat and all the calories that we consume, both in the forms of food and drink in this country. So I wouldn't be worried if you're losing weight fast.
Right.
It's okay.
Yeah. And with is there danger in losing weight too fast? I do also have people say, well, I need to do it low and slow so that I keep it off. And that's, again, maybe true for them, but studies actually show the quicker you lose in the beginning, the more likely you are to keep it off, just like Doc said. Something that I bring up a lot to my patients to try to help them understand why it is so hard is the fact that we will never accidentally lose weight unless we are sick. And that's something you really want to think through, right? Anybody that we know who is losing weight unintentionally, there is something likely wrong that they need to seek medical care for. Weight loss is something we have to put effort into. We have to make happen. For some people, it is an extremely, extremely difficult task that they have to spend a lot of energy, a lot of time, a lot of money on. Other people, they change a couple of things, but they are still putting effort in, and it maybe comes off a little bit easier for them. Either way, though, we have to make it happen, right? So when you are intentionally making significant changes to your health and the weight is coming off rapidly, that is a good thing. But we're also going to really make sure that the calories that you're consuming, even if it's a very small amount, if you're doing fasting, intermittent fasting, right? The calories you're consuming have some protein in them. And this is not a surprise for patients of ours to hear. We talk all the time about the importance of protein because when you are losing weight, whether it's more slowly or rapidly, we do want to preserve your muscle mass. And by consuming amino acids and protein, that is an excellent way to do that. It keeps your metabolic rate up, it keeps your muscles strong, and it keeps your body going after the adipose tissue or the fat tissue and not the muscle tissue. Okay, so keep that in mind, Trey. As long as you're consuming good amounts of protein when you are consuming any food at all, there is no danger there. There's no danger there.
Hey, Tess from Cary. I've heard that diet breaks can help you lose weight and reduce plateaus. Is there any truth to that? And if so, how should I approach a diet break? I would just be careful in this regard. I think that idea, the idea, largely comes from the fact that your body gets adapted. It's designed to do this, to adapt to what you're doing, to be as efficient as it can be. So if you're taking in a certain number of calories of a certain kind, the idea is you'll get adapted to that and you'll learn to burn that exact number of calories, right? And certainly in circles where there's a lot of physical training going on, this is a concept that is encouraged. And what I would say is that if people can be addicted to food, and so if taking the break means you're going to delve into something that is an addictive substance and that leads you to a pattern of bad behaviors, you're taking a break is going to lead to things that are undesirable.
And if it's letting your horse out of the barn,
yes,
right? We don't, and it's hard to corral that guy back in.
It depends on what kind of person you are. If you're a really disciplined person and you say, okay, now I'm going to take one cheat meal, I've been stuck on the same plateau for 3 weeks or whatever, and prior to this I've had several months of really rock solid dieting and weight loss. Well, make it one cheat meal. and it's over after the cheat meal, and then see what happens to your weight. Does it come off the plateau a day or two later or not? And so, but it can't be, hey, I'm taking the cheat meal, I'm going to the spaghetti joint, I'm going to eat the spaghetti, it's going to be awesome. And then next thing you know, for the next 3 nights, you're eating pizza, you're eating lasagna, and you see you get into a pattern, it's destructive.
Mm-hmm.
And so anyway, I'm not against the idea of taking, cheat meals and short breaks and stuff like that if they're done in a really controlled manner, and you can do that.
Right.
The other thing to consider is let's just step away and consider our car, right? And we say, well, my car needs a break from all this gas. They got a sale at the garden center down here on peat moss. I think I'll stick a bunch of peat moss in my car, instead of the gas. I'm going to give my car a break off this gas, right? Is your car going to run good on peat moss? No. Okay, food is fuel. And when you put bad fuel into your body, you usually are not going to get a good result. So that's the other thing. I'm not a big fan of just taking a break and eating junk and then expecting your body to feel good. And I don't think it's going to feel good from that. And I don't think you're going to like the health result that you get. Anyway.
I completely agree. Yeah. Michelle commented, good morning. It's my first time joining your Facebook Live, and it's very informative. Thank you so much. We appreciate that. And make sure to check out others and share them as well. And we have a couple more. Maybe Charlie joined. I think that might be the only one so far. Okay, thank you. If you haven't yet, Michelle, comment #Simon's AMA and like this video. That way you're entered into this gift card as well. So Tess, excellent question. I'll just continue on that for a moment. For most of our patients, that is not a true statement. Okay, so the majority of people, this is not a requirement in order for them to get through their plateaus. When a plateau happens, it does indicate something needs to change. However, it is not typically a default that the thing that needs to change is to come completely off of plan for any amount of time. That may be something, but typically what we're going to do is we're going to change a more healthier variable within. So maybe we're going to do a little bit of fasting if we're eating 3 meals a day, or maybe if we're doing a lot of fasting, maybe we'll eat 2 or 3 meals in a day. So it's still within the plan that we had originally set, keeping very nutrient dense, high protein food a part of that plan, and not saying, oh, you're on a plateau, this is a good time to go get a buffet of spaghetti and pasta. That's not something you're going to hear us say a lot here. But that doesn't mean that on occasion for certain individuals it doesn't work. So how are you going to approach it if you're going to do it? Like Doc said, you're going to have a plan. You're going to indulge one time, with a planned set idea of what that looks like, and then you're going to plan what it looks like at your next meal, whether that's the next morning or the next meal on that day, of how you're going to get that right back on and not let it sort of roll down the hill.
Right.
Okay.
Yeah. That's exactly right. Okay, Claire from Garner. She says, I cut my calories to 1,000 calories a day and I'm still not losing weight. What am I doing wrong?
That's frustrating.
Well, first, make sure your calorie count's right, okay? Because I have a lot of people that think they're eating a certain number of calories, but when they get a lot more specific about it, they realize, oh, no, it's more than what I realized. So make sure it's 1,000. Because most people will lose weight on 1,000 a day. And that then goes to the second concept. Look at the content.
Mm-hmm.
Because as I said, 1,000 calories from Twinkies is not the same as 1,000 calories from meat. The way your body responds to it is entirely different. And so, I would look at the content. And then the third thing is there are some medical conditions that make it hard to lose weight. Mm-hmm. Even when you do calorie restriction, you lose, but just not very quickly. Things like hypothyroidism, for example. Mm-hmm. And this may be a sign that you have something like that. Okay, if you're absolutely rock solid about this sort of thing, then maybe it's more of a medical problem, and we can help you with that. That's what we do, and this would be a good time to come see us. All right. So and that's why we do the metabolic assessment that we do.
Exactly.
We kind of go over really what your health scenario is and try to identify these things that might slow you down, right?
Absolutely. Yeah. We do have it is typically women in our practice who have basically said they've dieted their entire lives So their metabolic rate, their body has been able to adjust because their input has just been lower and lower and lower for so long, or periods where it drops way, way, way down, that their output, their metabolic rate, has also matched it. Just like Doc was talking about adaptation, right? The body's pretty good at maintaining homeostasis, whether it's our temperature, our pH, right, our body weight, our heart rate. There's a a goal that the brain has, and when we stray away from that, it will do everything it can to get us back into the goal that it thinks. And for a lot of us, when we've been a higher weight and then we drop weight, the body pushes right back up to try to get us back. So Claire, there's a lot of factors here that we would want to talk about with you, right? Like how, your history of dieting, your history of body weight. Have you already lost 150 pounds, right? Because that makes this question very different to answer. Have you had a surgery, right? Your other medical conditions. And that's, again, what that individualized metabolic assessment is when you come to our practice, is you are not going to get handed a sheet of paper that says, just eat this and goodbye, right? We are really going to hone in on what we think is going to work best for you. And you are going to help figure that out as well, because you know yourself far better than we do, right? We may be experts in our field, but we are not experts in your body, your history, your determination, your goals. So that's where we meet. We meet, and it's a team effort for sure. So give us a call, Claire. And I know that's very, very frustrating to go through.
All right, Peter, we kind of touched on Peter's one question. He's really got two here. So Peter from Raleigh asks, I track my calories, and often after I hit my calorie goals, I am still so hungry. What am I doing wrong, and how can I help reduce cravings? Number one, come to an office location of Dr. Simon's Metabolics and Weight Loss and see us.
Yes.
You're probably in need of some medication to help you.
Yeah.
Okay. So, and look, we need to go over really, your nutrition plan, what behavioral changes you've made, what you're doing for physical activity. You need some medication, and can we match you with stuff that's going to bring this under control? We can kind of touch on all those things. And we just talked about in the last question, the idea of a metabolic assessment, do all that. And so anyway, I think this will get you moving in the right direction and bring both the hunger and the cravings under control. And as I've mentioned earlier, if you're eating the right kind of stuff, you would be surprised that you can lose weight fairly easily without having to do a drastic calorie restriction. Just getting the content of what you're eating right will help you. And we do this every day. This is what we steer you toward the right things.
And the medication is extraordinarily necessary and helpful for the vast majority of people who are going through the same struggle. It is not a crutch. It is not cheating. It is a tool. Okay. If your blood pressure was high and you went to your primary care, they would say, I want to put you on medication to lower your blood pressure. And what they wouldn't say after that is, and then as soon as your blood pressure is normal, I'm going to take your medication away. And you get to just figure it out from there, right? It is a long-term treatment because it doesn't get fixed like that, right? No chronic disease does. And weight, when we struggle with weight, it is a chronic thing, right? Hunger goes up as weight goes down. This is a phenomenon that without use of medication, people experience. It is not the medication causing that to happen. Anybody who has attempted caloric restriction over time will find at some point the same things they were eating, they feel hungrier. And it's confusing, but it's because their body is trying to get that weight back up, get that body fat percentage back up. So medications like phentermine, which is an appetite suppressant that has been on the market since 1959 and has never left the market. It has been on the whole time. We use a lot. It reduces appetite. It reduces cravings. It improves fullness. It improves metabolic rate. It improves energy. It improves focus. It is a fantastic medication for so many.
It's well
people.
tolerated, it's safe, and
It
it's
is.
and so we use a lot of that, but we use some other things. And sometimes we do combination drug therapy with things like topiramate and metformin. In addition to the phentermine, there's newer medications like Contrave or Saxenda or Wegovy, or even some stuff that's we think it's going to be approved like Mounjaro. We use all that stuff, and we often use it in combination. So we believe in the full court press method. Bring it under control, right?
Yeah.
And so I think that separates us from a lot of other practices, is we don't expect that you just on willpower are going to be doing all of this. If medically you need medicine, then we need to put you on it and then get you to the point where it's all under control.
Yeah.
Right? Just like your blood pressure in your analogy,
Absolutely.
right?
Absolutely.
Okay. So the winner of today's $25 gift card is
Melissa.
Melissa.
Thank you so much, everybody who tuned in with us and who entered and who commented and even showed some vulnerability, talking about things that are hard, right? That's what we're here for, is to talk about the hard stuff and help you with it. We will message you on Facebook, Melissa, to get the details to you about how we're going to get you that gift card. And everybody tune in again in 2 weeks. Thank you so much for watching.
Thanks for watching, everybody. We'll see you in 2 weeks.
Yeah. Check out the recordings of this on our website.
Yep.